Hey you guys, welcome back. As promised, on this topic of antibiotics, we'll be covering gram positive and gram negative bacteria, just hitting on those main ones that fall into each category and the type of antibiotics that can be utilized to treat the two. So, as always, welcome. For those of you who are familiar with me, hey, you guys, hey, y'all, how are y'all? And for those of you who are new to me, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I design these videos for nurses and nurse practitioners to help assist with your success on exams, boards, as well as in practice. And in medicine, there's no absolutes. We treat on a patient by patient basis. So use this for information and not treatment purposes, okay? All right, let's get into the material, you guys. All right, so gram positive, gram negative. What does that really mean? So honestly, I'm big on breaking things down, and gram simply just is referring to the staining process. It came from the developer's last name. His last name was Graham, so that's where that even comes from in this. And then um, based on how the color looks when stained, it shows the response, and that's how they categorize it versus positive versus negative. The positive ones have that thick cell wall, whereas gram negative have a thin cell wall. Okay. One big thing that you should remember about gram negative bacteria, these are more of those uncommon bacteria, and the significance of it is due to that high resistance to antibiotics. These are that category that have um, a high rate of resistance to antibiotics. Is that I guess the best way to explain that. So let's think about what falls into those. And again, just giving you those basic ones that are commonly seen. So gram positive, we have those staffs. Think of the P in the word staph. So your staph aureus, your staph epidermis, all the skin infections and things of that nature. Also your streptococci, like your streptococca pneumoniae, and then your enterococci. So those are the ones I really say pay attention to, right? So our staph, our strep, and our enterococci. When you think of positive, P, S, and E are all in the word positive. So staph has the S and the P. Strep has the S and the P, and then enterococci is our E. Okay, so hopefully that'll kind of help you think of it when you're scrambling through, if you're trying to just work your way through and navigate quickly for testing purposes. But again, gram positive, your staph aureus, your staph epidermis, your strep, your enterococci. Okay. Gram negative are your things like your E. coli, your Campylobacter, your Legionella, your Salmonellas. So I always say the negative, the things that sound a little bit different. They all are not your easiest terms, but that E. coli, the Legionellas, all the Ellas, Legionella, Salmonella, Campylobacter, to me, all that stuff, it really messes with your stomach and can be found in like food issues that are not handled properly, like your meats and things like that. I kind of think on that terms, like your E. coli, the salmonella, and those. So I feel like it's negative. Your stomach, it's a negative vibe, and your stomach is all mixed up with those things. I don't know. Y'all know Britney's brilliance. My brain always goes to the weird stuff to make me remember and retain things. So let's slow it down and go back. So gram positive has that thick cell wall, and the three main categories of bacteria that fall under this are your staph, your strep, and your enterococci. Now, your gram negative has that thin cell wall. It's highly resistant to antibiotics. So, we really want to pay close attention to the treatments on these because you can have that resistance. But those are the ones, give those negative vibes. Upset stomach is commonly associated with these. But your E. coli, your Campylobacter, your Legionella, your Salmonella, right? Okay. Now let's talk about the antibiotics that we would utilize in the treatment of gram positive and gram negative. Now, when we break things down versus gram negative, there are some that we, are utilized to treat both gram positive and gram negative. And I don't want you to get so detailed in it because it's not like boards is breaking it down to the extent to ask you, all right, is this a gram positive or negative? Did it show up blue or did it show up pink? It's not. That's really the deep biology of things. But when you are considering which ones to utilize for treatment in practice, these things are those that you need to be aware of. And the significance is thinking of the high resistance, thinking of those bactericidal versus bacteriostatic in your immunocompromised patients and things of those nature. So I like to give you that knowledge so that when you are on exam, if they're giving you that background, you can work through, because I'm big on knowing the why. So if you understand this as you should, it will help you to break it down when in doubt. Okay. So those treatment options for antibiotic for those gram positives are your penicillins, your macrolides, your sulfonamides, your tetracyclines, your doxy. And your fluoroquinolones can be utilized sometimes also. It's more commonly in the um, gram neg, but it can be utilized sometimes for those gram positive. Now, your gram negative ones that we can utilize are your tetracyclines, your fluoroquinolones, your macrolides are utilized sometimes, just very rarely, but sometimes. Sulfonamides and penicillins are also utilized sometimes, but the main ones for gram negatives are those tetracyclines and those fluoroquinolones. Screenshot the list if you need to help you. But I just wanted to give you a short and sweet run through, and we can do a recap on what we've talked about so far. I did a full video, but if you didn't see the one from the other day, on bactericidal versus bacteriostatic, I broke down those as well. Cidal, remembering, meaning to kill, so it works to kill the bacteria. Static, meaning to stop motion, still, so it's stopping the growth of the bacteria. Remembering that those ones that are bactericidal are your PCF, penicillin, cephalosporins, and your fluoroquinolones. And your statics is your TMS, your tetracyclines, your macrolides, and your sulfonamides, right? Um, and then remembering these gram positive and gram negative lists that we just went over, and then tie it all together. And we'll continue throughout the month to build just like this so that you'll be able to hopefully the plan is to give this to you in smaller chunks so that you are able to quickly identify, know the groups, break it down to understand what is it is utilized to treat certain bacteria, how it affects the bacteria, and why, so that you are truly understanding why you're utilizing these for certain bacteria in certain patient populations. Okay. All right, you guys, I know that was a lot in a small and short video, but I hope you found it helpful. Let me know if you did or did not. If you need me to explain it a little bit differently, let me know. I'm always happy to do so. We're covering this all month long, so feel free to put it in the comments and I will go into those things. But as always, thank you guys for watching. Be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. Make sure you meet me back here. And if you need me for any one-on-one sessions or have any other questions and want to utilize any resources, you can contact me at the Nurse Studio at 803-400-6864 or shoot me an email at the nursestudio1@gmail.com. Bye, y'all.